Good afternoon, everyone. Thank you for all joining us today for our session on the general practice data sharing change from Pensius to outcome health session. We will just give it a moment as people are entering the virtual room. While you're entering, you might want to consider updating your participant name to reflect your name. It could be under a phone name or an email address, but you might want to just change that setting while we're waiting to ensure that it's reflective of your name so we can address you during the session if you have any questions. Okay. Thank you to those who are joining us. I can see we've still got some people jumping in, so we'll give it just one more moment and then we will kick off. Okay. To ensure that we've got enough time for today, I will start by welcoming everyone to our session today on the general practice data sharing change that is occurring in Northwest Melbourne PHN information session. So I'd like to start this session by acknowledging the traditional owners of the land which our work takes place, the Wurundjeri Wurrung people, the Bunurong people and the Wathaurong people, and pay my respects to elders past, present and emerging, and recognise any Aboriginal and Torres Strait Islander people in the meeting today. So, for those who haven't met me, my name is Jessica. I am the Director of the Primary Healthcare Improvement Team here at Northwest Melbourne Primary Health Network. I do want to welcome you all for coming along today and joining us in a really busy time for general practice and also a time that you're taking out from seeing patients and the work of general practice. So thank you so much for joining us. Just some housekeeping before we get into the content of today. We're just asking people to please place yourself on mute to allow for the best quality audio for the session today. We will be accepting questions throughout the session today. So please, if you've got questions, pop them in the chat at any time during the session and we'll make sure that we've got plenty of time for Q&A. We do want to just recognise that this session is recorded so we can share the recording with other people who are unable to make it today. And also you can pass this recording on to anyone in your general practice who's interested in hearing this information who wasn't able to make it. Okay, so I just wanted to start by going through the purpose of today's info session and just getting really clear on what we'll be talking about today so everyone's aware of the content that you'll be hearing from Northwest Melbourne as well as the Outcome Health team today. So what we'll be going through today is, as you're aware, Northwest Melbourne PHN is undertaking a change to their general practice data sharing tool. So what we'll be doing is actually going through the background and context to this change. We'll be explaining what's changing and why, and we'll be outlining what this means for you and your general practice teams and the key milestones and dates for transition activities. You'll hear a little bit from the Polar team and the Outcome Health team on the tool, but we won't be doing a deep dive training and education session on the tool today. That will be coming later in the year and we'll be going through the timeframes for that. So if you are here for a deep dive education session on the Polar tools, we won't be going specifically into that today, but you'll hear a little bit about the tools. We'll also have some time for to go through some frequently asked questions that we've already seen. received since announcing the change, and we'll be opening up the floor for Q&As for any questions for the team at Northwest Melbourne, as well as the Polar and the Outcome Health teams. So, who's in the room today that will be walking you through the information session is myself, Philip, who is leading the transition from Northwest Melbourne, Jocelyn, who you may have spoken to if you've worked through a data sharing agreement already with the PHN, and Emma, who is responsible for our insights, performance and digital services and looks after our data governance, analytics and work that we do in that space. Then we have representatives from the Outcome Health team who will be the ones who are providing the day-to-day support on the Polar tools and working to support your general practices. Great. So I just wanted to start by a lot of people would know this in the room, but just wanted to give a little bit of background and context to PHNs and the work that we do with general practices around collecting and storing data and the tools that we provide. So as you all know, the PHN has a key role in both collecting de-identified data from general practice to collate for local data sharing and population health needs. We also are the administrators of the PIPQI incentive program, as the Department of Health has deemed our role in that. We also have a key role in building capability of general practice through the provision of quality improvement support, data decision tools. We also have a very key role in ensuring that we've got key population health planning activities and data that supports making good informed decision for our PHN region. So the context of this change is our PHN has previously had an arrangement with PenCS vendor to supply the data sharing and analysis tools that you use in general practice, but we are, as you know, undertaking a change. So I'm going to hand over to Emma, who is the Executive Director of our Data Insights and Performance team, who's going to step through what's changing and why.
Hi everyone, thanks for joining us today. So yeah, as Jess said, currently the PHNs provide general practices with a product and a suite of tools to support the data extraction and the analysis of the data that you supply to us to ultimately improve service planning, reporting and population health monitoring. So over the last almost 12 months, we've been carrying out a review of the different products and tools available across the sector to support us with this work. So it's really important to us that at this point in time, we took the opportunity to do this sort of evaluation and assessment of the various products that were available in the market, so that we can make sure that we're efficiently delivering on the Commonwealth's sort of requirement of us to collect data and also to provide practices with the tools to help them with their quality improvement initiatives. So there's a number of reasons as to why we're undertaking that now. There's all the broader sort of policy and primary care reform directions that are changing that we need to consider how they affect general practice and PHNs moving forward. Our contract with the current vendor, PenCS, it was up for renewal. And there also has been some change in the market in terms of what's available to PHNs and general practices. So we just wanted to make sure that we were doing that evaluation to just really understand what was out there and what would be suitable for our needs. One thing also that's important just to mention is that even with the current tools that you have available to you with PenCS, that is changing. But as a part of what would be changing, it wasn't only just about our contract. The current Cat4 product, which is provided by PenCS, that was actually going to be decommissioned. So we were being asked to make a change in the product that was being used. And so it wouldn't have just sort of maintained consistency over the next 12 months, there would have been a change in the tools that were available regardless. So again, that was just a really good time for us to be looking at what's available. So it's really important to us that we undertook a very rigorous and evidence-based review of what was available. So I was just going to take you through a very high-level summary of what it was that we undertook and sought to understand through that evaluation. So, as I said, the evaluation took us about nearly 8 to 12 months and included some key steps. There are 3 main tools in the market. So there's the PATCAT products from PenCS, Polar from Outcome Health, and we also considered the Primary Sense tool that's available from the WA Primary Health Alliance. So just a very quick whistle-stop high-level tour. Through the evaluation, we developed a detailed list of both functional and technical requirements. We then developed a number of use cases or scenarios that we wanted to test each of those 3 tools against. We tested each of the tools, starting with our existing product with PenCS, to set a baseline of the current sort of functions and capability. And then we recorded the outcomes of each of those tests in an evaluation matrix, so that we were really taking this evidence-based assessment to how each of those products performed. We also received product demonstrations from each of the vendors and sought their direct response to specific questions, and we talked to them about their future development plans and new functions that may become available further down the track. The result of this was that we shortlisted 2 of the products, and at that point we engaged more deeply with the vendors of those products to understand costing, data hosting, technical requirements, and to also explore what the transition steps would look like for the PHN internally. So what is it that we need to do to make sure that we're setting things up to ensure this is as smooth as possible. But then, of course, also very importantly, what is it that we would be needing general practices to do throughout this process as well, trying to minimise the impact as much as we could. One other thing that we did as well throughout the whole process actually was we engaged with PHNs that have been sort of long existing users of each of the products, or those who have recently transitioned to a new product, to really understand their experience throughout that process, their experience of using the tools, and also the experience of their general practices in using the tools as well, and getting some feedback on that and feeding that into our considerations. So as you know already, Outcome Health was selected based on the sort of culmination of all of that activity. And that was really based on sort of the outcomes of the evaluation, competitive pricing that was offered, and also the performance of Outcome Health throughout the process, who really displayed a commitment to maintaining open and transparent conversations with us, to really working with us and with general practice to understand our needs, and to work with us on tailoring some tools that may become available further down the line as well. What does that mean for all of you? What does that mean for general practice? So commencing from April, you will all have access, any general practice within our region will be able to access the Polar tools. So you will have, hopefully, if not, you need to get in touch with us very urgently. Hopefully have already received some communication from us about a new data sharing agreement that does need to be signed. Once that's signed, Polar will be able to begin the installation and onboarding of the new tool at your practice. Ideally, we'll have that completed by the 1st of July. Throughout that process, we'll be providing really tailored support, and Jess will go into this in a little bit more detail, but We are here to provide tailored support to help, in particular, those frequent and high users of the existing system, because we want to, really limit the impact that this has for general practice. We're here to support you through that process. Details will be provided later on what that includes and how you can get in touch if you need more support. For PenCS, so current funding for that tool set will end at the end of June, so the 30th of June. There are options for, I'm not sure if I should say, but there are options for general practice to still continue using that tool under their own accord. We won't be able to get the data extraction from that, but if there is, they feel free to speak to PenCS. But we are quite sure that in the outcome health tools, everything that you need to do the work that you are doing around quality improvement and to provide the data to us will all be available in the outcome health tools. So there should be nothing to worry about there. We do and are very conscious of the PIPQI process. And so we will be using PenCS to submit the PIPQI data for this quarter. So that's the April to June quarter. And so to ensure there's no disruption to that, we are asking that you have your data submitted for April or May so that we can use that data for the PIPQI payment process. We'll have some members of Jess's team that might be reaching out to you just to make sure that the data is submitted and that there's no disruption to your payments. So Jess is just going to go through that in a little bit more detail now and just step it out.
Thanks, Emma. Just to note, we were really conscious of, while we were going through this process, as Emma mentioned, the change for general practice and the impact of that change on your general practice teams, the systems that you use and the current activities that you undertake using the tools. So we are coming into this very aware, and we are wanting to really work and support and facilitate as much support for the general practice teams that you require, and really tailor that based on what your requirements are, whether you're going, you're an infrequent user of the PenCS products, or, as Emma mentioned, a frequent and high user. We're really wanting to work through our relationship managers and your practice teams to understand where you are at with this change, and how do we actually help the change management, the education, the training, the onboarding. So if you haven't already heard from your relationship manager from the PHN around this change, and how you will hear from them really shortly to ensure, one, that you've got your data sharing agreements lined up and you're compliant for the PIPQI quarter, but also how do we set up a good plan of support for you to work through the change in your practice, and ensuring that you're utilising and maximising the new suite of tools that you'll have at your practice team's disposal. So during that process, please reach out to the PHN if there's anything additional that you will need or that we can be helpful for in that space that we might be missing. We are really keen for feedback, and we really want to collaborate and co-design our approaches in terms of your education, training and onboarding support needs for the new tool that is going to help you in your general practice do what you do best. So just some key dates to be mindful of that we, as you know, we've been doing some work on communicating the changes. Obviously, this information session is part of that. We have sent out all of the data sharing agreements to your general practice. So as Emma mentioned, if you haven't heard from us, please reach out. But we are also working proactively to ensure that our general practices are engaged and aware of the process. We'll be working to ensure that we've got good 100% PIPQI compliance, to ensure that your PIPQI payments are, there is no risk to those, and that they are all submitted using the PenCS products. And at the moment, we are working on the development and also looking for people to participate in the co-design of our general practice training and education program, which we will start launching over the coming months. We are also looking at pulling together our hub website hub where we'll have lots of information, training videos that will help you walk through and understand the Polar tools and the application in your general practice. And we'll also have recipes, we'll have case studies, we'll have articles, we'll have a whole suite of information that and FAQs around data sharing agreements, any questions you might have around Polar or the transition, we'll have that in a hub that's coming really soon, and we'll be, as soon as that's available, we'll be sending out a link to our general practices to help support them. During that time, we will be working through that onboarding support, training, education with really a focus from May to June, with the last day of general practices having access to the PenCS tools through the PHN licence being the 30th of June 2025. From the 1st of July, we will be moving to all general practices having access to the Polar tools. And again, really looking at the work that we'll be doing is how do we engage and support our general practices, making the most of those tools, being really aware about the different components of those tools and how they will work in your general practice to support good patient outcomes. So just to go through some very practical steps in terms of sharing the data sharing agreement with the PHN, we have sent new data sharing agreements out to all general practices. And once that agreement is signed, you'll receive that through DocuSign. That comes through to the PHN to administer. And then what we will do is set up your practice profile with Polar, and you'll be contacted to arrange a time for installation. So there's a couple little steps that we will absolutely be supporting you through as a general practice team, but we really want to make sure that your general practice is aware of the steps and what is needed to support Outcome Health getting in touch and connecting with you on installation time as well. So we're hoping to make this a very smooth process that, again, the PHN will be guiding you through at all steps. So it's a little bit about us supporting you to make sure that you're aware about the steps, but also there will be just a little bit of work at the general practice end to make sure that general practice team members are aware and that all the people in your practice are aware of the change and what it means for them. So if there is any support that you need from the PHN for us to come out and chat to your practice team, provide more in-depth information and Q&A sessions, we're really happy to do that. Please reach out to your relationship manager so we can help support that awareness in your practice. Or absolutely, you can share this information session with them so they're aware of the change. Thanks. In terms of the data sharing, I just wanted to go through, obviously you would have all received your data sharing agreements, but I just wanted to be really clear that as a PHN, we do have two options for general practices to be sharing data. So option one is submitting your full de-identified data set using Polar, where you will receive the PHN funded Polar license, will receive de-identified data and on an agreed schedule and time. Option two is using the JSON file method, which is done manually through your clinical software system and uploads into a Polar portal. I found my word. And that ensures that you have submitted data to the PHN, which makes you eligible for the PIPQI. So absolutely, those options are in the hands of the general practice teams to make decisions on. We can absolutely support and work through what that means for your general practice. So please reach out, but we just want to be really clear that there are different options for working with these data submission tools, and that your practice does have a choice, and we are very happy to talk you through that choice as a practice team. Now, I wanted to just go through our plan for the support that general practices are going to receive. Like I said, we are really cognizant of the investment in time, in training, in use of the previous PenCS tools at each general practice level. We know that a lot of people really love the tools, get a lot out of them, have set up some of their systems and improvement activities based on the PenCS tools. So I just really want to acknowledge that work and recognise that the PHN and our general practice engagement and support team are really here to help support that change in your practice. So as I mentioned, you'll receive tailored support, and we will be reaching out to your general practice to make that plan around what your team needs to help navigate the change in your practice. There will be priority support based on that tailored support and reach out for the frequent and high users of the PenCS tool. So we have the data on who uses those tools frequently, and we will be reaching out to your practice if you are one of those users to talk to you about this change and how do we ensure continuation of the support and tools that you use in general practice. We will be rolling out an education training strategy and program for all of the general practice users in your practice over the coming months, and that will continue on throughout the year and for however long we are supporting our general practice with these key capability building tools. We will be designing, developing and rolling out resources, articles, recipes and a whole lot of practical information which will help drive the use of the POLA tools to help improve patient outcomes in your practice. As I said, those informations will be in a really to easy find website hub that we'll have, and there's also functionality through your POLA tools around how to navigate some of the recipes and tools in POLA. We also have a dedicated inbox and helpline that will help with questions or inquiries regarding the transition to POLA. We have a whole team of people here at the PHN relationship managers who are there to work through and support. We are really keen to walk through this change with our general practice teams and hear from them about what's working, what's not, how can we improve the support or the resourcing that general practice need to ensure they've got a smooth transition and change. So I'm going to hand over now to the Outcome Health team, who are going to step through for everyone a little bit about the POLA tools and their approach.
Hello everyone, my name is Peter Latinovic. I'm the IT security specialist for Outcome Health. I guess I'm here to talk a little bit about us. Outcome Health has existed in the industry for over 20 years. We are more than just the POLA platform, and I'll quickly run past a couple of things we also do. We are the innovation from the form of decision-making health connectivity. Our ethos is to create good tools for the community, whether it's through our clinical services or through the POLA platform. We are a not-for-profit organization. That means that as we generate revenue, we reinvest back into the organization so we can create a better platform, create more innovation, and continually promote health across the communities. We have effectively 3 areas of the business. We have the mental health and chronic disease support services. We have mental health nurse placements in hospitals. We also work with Ambulance Victoria. The second part is the POLA platform. Some of you may be asking, what does POLA stand for? It actually stands for Population Health. Oh, Lord. Population level analytics and reporting. I should know this better, shouldn't I? We have deployed in over 2,000 GP clinics across Australia. So we are quite well known in the industry. And the last part is the ethic-based ecosystem for research. This research is done by an opt-in only, and it's run on a de-identified basis. We seek approval from all the parties when we're doing the research, so we are very transparent. And because it's ethics-based, we're very focused on who this research is done by. Okay. So let's talk about the POLA platform itself. So the idea behind POLA is to lead efficiencies with minimal human intervention. The idea is that we shift the focus from the practice managers and healthcare providers, so they focus on providing healthcare rather than managing a software suite. This is why we are very light on. Polar just requires one Hummingbird installation, and then everything else is managed by us. Obviously, if you have an issue, obviously we're here to support you as well. We are a secure platform. We follow best industry practices, as evident by our ISO 27001 certification. We invest quite considerable amounts into security, and we also do a lot of proactive security approaches across the platform. While we only take de-identified data sets, the way we operate is we consider the data as identifiable from the security approach only. So we like to invest and implement the highest degree of security, irrespective of the data that we hold. Polar is a web-based ecosystem. We have three primary tools. We have the Polar web-based reporting, which we'll get more and more familiar with. We have the Walrus, which is the point-of-care tool. As an additional one of our recent launched product is Husky, which is an appointment book optimization with ProtaChecks. I guess as part of our automation, one of the big burdens is how do we deal with data? So one of the methods we apply is something called the data mapping, where we try to simplify the complexity of the unstructured data that is within the practice management systems. And then we apply various mappings, such as SNOMED on the diagnoses. And then we also do additional grouping. So if you want to concentrate on a particular type of, let's say, I don't know, focuses on the respiratory systems, you will be able to select that as a higher level group, and that would include all the relevant SNOMED diagnoses as well. Immunizations and pathology, obviously they're mapped to higher level groups as well. All of these things will become apparent as you start consuming the reports within the Polar platform, and you will see the uniqueness and the product offering of us. Yep. Next slide, please. I'll try and, I won't bore you with the details, but feel free to ask any questions, obviously. So the web-based reporting comes in two styles. We have a data discovery, which is our clinical summary report. There could be how many patients do I have on a particular criteria set. That criteria set could include or exclude diagnosis, chronic diseases, and things like that. And then the second part is the guided analytics, such as PIP-QI, hospitalization risks, QIPC, and particular chronic disease reporting. So these are meant to help you answer the question around that particular topic. While the summary report is, how do I find these patients? And then the guided analytics that kind of help you drill down on that cohort. And quickly, just Walrus, the point of care. I believe the PanCS equivalent is called the top bar. So we have our own. It's a local installation that can be done any user. Doesn't require administrative privileges. It integrates with the clinical system. I believe only medical direct and best practice are currently supported because there are technological limitations with the others. And it's effectively the same Polar content that we extract. However, it is targeted. It can help you identify things that potentially are missing or particular patients that you would like to get further details on that are the most frequently asked questions. So we have a quick question from Jen Tan. How frequently will the data extraction occur? So the system is clever. Once the Hummingbird is installed, it will do the full data extraction. And then from then onwards, it will only extract in changes. And I believe this takes every 5 or so minutes. The changes are put into data warehouses. However, it may take up to 24 hours for the data to be churned and mapped and transformed before it's available in your reports. Hope that answered your question. Yep. That's it from me. Looking forward to working with all of you.
Thank you so much, Peter. And thank you to everyone who's been popping some really great questions into the chat. I've been keeping an eye on that. And Adita Peter has got another what is Walrus then? Do you want to go into a little bit more depth
Sure.
there about Walrus?
Yeah. So I guess quickly, so Hummingbird is a software that allows to do data extraction. Polar Explorer is the dashboard on how you consume the reports, and the Walrus is a little client you can install on your machine that will monitor, for example, best practice. As you change open patients, it will be able to identify which patient is open and then provide the transform data sets out of Polar straight onto your screen rather than through the web interface. So it's kind of like a patient by patient approach rather than a large cohort, all the patients in a single report.
Yeah, well, Walrus is intended to be a point of care tool. So it presents the data for the patient in front of the doctor at that point in time, and will allow you to identify missing pieces of information. It will allow you to identify available services for that patient. It will allow you to receive risk-based profiling of that particular patient, depending on what data has been seen previously in the system.
Thank you, Peter and Jamie, and thank you so much for the questions in the chat. There's actually a couple of questions that I think would be really good for us to add to our frequent asked questions document, which can sort of include some of the definitions around the tools and the language that's used in this new space. So we've got a couple of frequently asked questions that have already come through from general practice teams. So we thought we might just touch on these very, very briefly. And Peter and Jamie, I hope it's okay, or Diego, just to go through quickly about how Polar does manage the data that comes in from general practice. We've got a response there, but you might want to just provide a little summary there.
So would you like me to read through this?
I'm happy for you just to talk to it if that's okay. Yeah.
Yeah, sure. So I think I kind of answered the majority of that part. It's effectively, we take, with the Hummingbird client sits beside the practice, usually it's installed on the best practice server. It should run 24 hours a day. The service needs to be active at any time of the day that Polar is used. There are Polar dependencies around stitching patients in the clinic summary report back together so you can find which patients you're referring to. That all application is relatively light. All it does is just data extraction, runs the de-identification process, and then lands it securely on our side. Obviously, it's all very secure, and it does obviously, encryption and all the security features of this product suite have been considered and are implemented into the client itself. So that means identifiable data doesn't leave your practice. And for us to do some of these, it's really important that the Hummingbird client stays operating 24 hours a day if possible. Thank you.
Great, thanks, Peter. The other question we had is there's practices with lots of workstations, very big general practice teams, and a question about Polar installation time. So just to let everyone know, and actually there was someone who's popped in the chat that installation took 15 minutes yesterday. It was very smooth, so thank you for that great feedback. But yes, the response to that one is a single installation at practice allows you to use Polar on any PC within the same network, regardless of the size of your practice. And I think it just goes to show, as someone who's worked with general practice supported around these data extraction tools, the evolution of these tools and how they're changing and becoming more sophisticated and much easier to use and implement within general practice. So that is very good news for everyone. There's a couple of questions as well in the chat that I might just address and reinforce. So there is a suite of tools that will be at general practice's disposal once you sign your data sharing agreement, and those include Walrus. Absolutely. up to the general practice with how quick they take on these tools, they learn, they implement them, they use them. The main thing we are wanting to do as a very minimum is support the general practice data sharing agreement to be signed so that you can share data and be compliant for your PIP-QI payments. That is absolute minimum. And then what we would want to do is absolutely work with your general practice teams based on where you're at and readiness for whether that's now. And I know we've had some really keen general practices who want to be trained and want to be shown the tools and have access to that. So that's really good. But you also may not be ready for that. And that's completely okay. These tools are for you to really work through at your own time. So just wanted to reinforce that. And we'll be working very closely with your general practice teams on that. Couple of questions about the access to the historical data. So just to say, the historical data from a practices system will be available in POLA and can be used to generate reports in POLA. Practices will not obviously have access to the PenCS reporting functions from the 30th of June 2025 this year. What will happen to our general practice access to the PenCat tools? So as Emma mentioned, practices will lose access to the Pen tools on the 30th of June, but if practice wish, they can enter an arrangement with PenCS for the continuation of the use of those tools, noting there are going to be changes to the Cat4 product as we understand. So you may want to just factor that in with your conversations if you are going to go down that path. And what happens to the data we already have with PenCS? So data extraction from the PenCS tools that the PHN already has will be archived and not used for the PIP-QI program moving forward from June 30, 2025. So that is the end of our formal presentation and some of the frequently asked questions. I can see Diego is doing an absolutely stellar job from Outcome Health in responding to a lot of the questions here, but what I might do as well is just pause and see if there's any questions from the audience, because I'm really happy for us to stop sharing the slide so we can see everyone and just allow people to come off mute and raise their question or continue to pop it into the chat. I'm just going to have a quick sneak to see if there's any that...
Jess, there's a really interesting question there. I don't know that I would actually like to throw to Outcome Health.
Yeah, great.
Can Walrus use AI and use a patient's available data for clinical interpretation and suggestions? Interesting question.
We have an AI roadmap. And using AI is something that we are looking at embedding within Walrus in the future. The key with anything AI is the things in the health space need to be done safely and securely. And as many people will be aware, that if you upload anything to ChatGPT, it's out there on the internet and it's available, and it's a scary place. So anything that we do with AI needs to be done effectively within very guarded walls. And that often means done within the practice. And doing things within the practice means that it's consuming the resources and the performance of the machines in the practice. Now, that is all good and well, but right now that is very, very heavy. And that will have a significant impact. What we are seeing, however, is that these AI models and some of the ones that we're working on already can be made light enough that they can run within the practice with minimal impact on the systems. So short version, not right now. Are we looking at it? Most definitely, because there's a lot of potential benefit in the health space for that type of analysis.
Thanks, Jamie. We've got a question around from Jen around the historical data, and I think this might be for previous quarter for reporting purposes. And Jen, I'm not sure if you're talking about general PIPQI, the PIPQI data that goes into our current Northwest Melbourne PIPQI report, or if you're talking about other data that you use through Penn. So Emma, Jamie, Peter, any advice on how that's going to work for practices in terms of looking at their previous data?
So yeah, I can give a basic overview of that, but also Jen, if you want to let me know specifically what you're looking for, I can give a more specific answer. But from a general perspective, the majority of data that's extracted is full term data for things like diagnosis and immunizations, things that have a validity for the entire patient life. When you're looking at things like certain medication scripts, you're looking at medical tests and the like, they're limited to 7 years. Services are limited to 7 years. So there's a lot of historical data available. We obviously don't want to bloat the system by importing everything over a patient's lifetime, because certain things get are less relevant as time goes on. Regarding PIPQI specifically, we have a process where we actually calculate PIPQI nightly. So in your PIPQI reporting, you can see if you're running a process or a program targeting one of the PIPQI metrics, you can do a bunch of work on that and then see your numbers shift the next day. So that you've got straight away. Then regarding the historical view, we actually back calculate for the previous 12 months from today. So even if you've only been on Polar for a month, we can use all of the data and the date that are against those items to back calculate what your metric would have looked like 3 months ago, 4 months ago. So you can actually look at trending and things like that. We've taken that approach because we do extensive mapping. If we, or the government, because the AIHW changes the rules on some of these metrics as well, if they change the calculation, then if you're comparing a calculation 3 months ago with the old rules and a calculation this month with the new rules, you're not comparing apples and apples. So we actually recalculate all of the PIPQI for the previous 12 months using the latest known rule set. So hopefully that helps. But if there's a specific area of reporting you want, please let me know and I can help out.
That's great. Thank you so much, Jamie. We've got a question around the time frame for once installation is completed. When are the login details ready for Polar, or what information will the practice receive to get them ready to jump in and use it, and how does that look?
Yep. Thanks. I started typing, but it's way
too thanks, Diego.
So once the data sharing agreement is signed, that goes back to Northwest, and that's what prompts the site creation on the Polar portal. If the admin is the person asking the question, you would have got that an email saying your site's been created, you're the admin, follow this thing to set your password. Other users will need to be created, and that can happen. We will run you how that works on the training sessions. So short answer, if you're the practice admin, you would have got, and you signed the DSA, you would have got an email already. Otherwise, you will get that your login credentials once you sign the DSA, and your PHN creates the practice for you, and then you keep an eye out on your emails.
Thanks, Diego. And I think that's actually a really great question and something that we can include in a bit of a workflow for general practice around the steps and what they should expect, and then which will help navigate through sort of the different process steps that we have. So we will do that, and really thank you for that question. I've got a question from Trevor. What is the process to update Hummingbird software? Does it auto update, or will we receive the software update alert to do the necessary? So I think this is for Outcome Health.
Yep.
You unmuted yourself, so I figured you would answer it.
Sure. I guess going back to my point of automation, Hummingbird does update itself. When the Hummingbird software is installed, there are two services that are installed with Hummingbird, one being the client, one being the updater. So as new releases of Hummingbird are made, our updater service will update the Hummingbird client automatically. So fully hands off.
Peter, just following on from Trevor, we're from CoHealth. We already have Hummingbird installed. So from that perspective, do we actually need to do any extra installation apart from getting access to set up the Polar sites?
Sorry, what was your question? You already have Hummingbird configured, is that correct?
We have it already for other purposes, but we have Hummingbird. Yeah.
Okay, so if Hummingbird is already installed in your practice, you should be ready to go. You will just need to get your credentials to be able to log in.
And one more question about that is, we've got multiple sites, and I imagine the contracts with individuals site, would that means every single site have their own instance in terms of viewing the data?
Yeah, so it really depends on how your sites are configured. So for example, best practice has the concept of locations. If you have a single best practice database, then we will do one Hummingbird installation and we will configure with locations. If you have multiple best practice databases or instances, then we will need to run additional Hummingbird installers. Yes.
Thank you.
Okay.
The key on that is that if you are running locations and you're looking at claiming PIP payments for the multiple locations, then we'll need to go through that location creation view. And linking back to your original question, in that situation, you'd have a single user account, and then within that user account, you can specify as an administrator which locations worth of data that user can see. So if you've got a user that only operates at one clinic, then you can then specify that they've only got access to the data at that particular clinic. So it's all configurable in the system.
Thank you. Great question, Jen. And I think it points to the fact that there are some complex setups across our general practice network and region. So we're really happy to work together with the general practice team as well as Polar and the Outcome Health team to make sure that what we've set up, configured and works in with your compliance for PIPQI and also the users and the visibility that you want for your general practice team. So just a note to say, if you are in that situation, for anyone listening, please reach out so we can work to set up those conversations and support your general practice needs. Okay, so the chat has gone a little quiet, but I'm really happy for people to, and thanks Jen for leading the way there, jump off mute and ask a question to anyone from either Outcome Health or the PHN. So I'll give it a little moment. While I'm waiting for any last questions, I just want to also mention that we will have a slide with a QR code. So I might just ask Jocelyn to pop that up, because sometimes a question might come to you afterwards. I know I've actually had a couple of people messaging me directly, which has been really nice during the session. So just a reminder about our email address and phone number. But if anyone's reached out to us directly through the chat, we'll also reach out and contact you about your specific question. But we are here to support you at the PHN. There is with change that comes a lot of questions, a lot of new information, and we will be learning and working through this together. So please feel free to reach out at any time. Also provide any feedback, any thoughts around what we could be doing better to provide the support that your general practice needs for this transition. And yeah, feel free to do that. We will be sending out a follow-up email post this session for everyone who's either registered or attended, just with the slides from today, the recording, as well as a link to some of the resources and information that we have mentioned. But if there is no other questions, I'll do a quick final call. I might just end with saying thank you to everyone who's come along today to provide information, the Outcome Health team, the team here at the PHN, but also my sincere thanks for such great engagement from our general practice teams who came along and took the time to hear about this change and the transition and the work we'll